It will go into effect tomorrow as a state of emergency. State of emergency in Ohio, as I explained when we went into the state of emergency, has very, very limited meaning. In some states it means a lot of different things, but in Ohio it has a very, very narrow meaning. And one of the things, for example, is in regard to procurement and emergencies that you don't have to go through the normal process. And so it's time for that to end as well. So that will be ending tomorrow. Just, a note to state the obvious, we still are losing people every single day to COVID. And there really is a dichotomy. There's really a fundamental difference between your safety if you're vaccinated and your safety if you're not vaccinated. On the one hand, you're safe. On the other hand, you're not. We have variants that are coming into the state. Things will continue to change. We'll have some more figures next week, but we continue to lose people who are dying every single day in Ohio because of COVID. A lot less than what it was. Hospitalizations are down, cases are down, positivity numbers are down. So we're certainly headed in the right direction. But that is being driven by the people who are vaccinated. And the people who are not vaccinated still run a very, very significant risk. We'll have more specific details as we drill down. The death rate, for example, those report very late, and we're trying to get a kind of an understanding of that, and we'll share some of that with you next week. Again, in regard to the orders, I want to talk a little bit about nursing home visitation as well as visitation in our assisted living. So we have been permitting visitation in our nursing homes, assisted living since the summer of 2020, last year. In March of this year, 2021, we required facilities to allow visitation. We are now at the point where the state needs to stand back in regard to visitation. But we really encourage nursing homes to allow for as much visitation as possible. And I'll talk about this in just a little bit more detail. Starting tomorrow, the state regulations describing how visits at nursing homes and assisted living should occur will be removed. For example, visits you will no longer need to schedule visits. Will no longer be a state requirement. Nor will there be a state requirement that you can only have 2 visitors at a time. So we've had few regulations left in regard to visitation in nursing homes. We're basically taking those off. Ohio nursing homes will, of course, need to continue to follow federal guidelines from the CMS. And both nursing homes and assisted living facilities will need to follow CDC guidance. So they'll continue to do that. The only thing that will remain, and I'll get into the one thing that's remaining. But so again, I think there's been a lot of confusion. We've gotten calls. People said we can only visit twice a week. That's not a regulation that we put on. Those nursing homes are making that decision. So we're making it very, very clear that beginning tomorrow, if the nursing home where your loved one has regulations, that is up to that nursing home. That is not something that we are imposing on that nursing home. They'll have to follow whatever federal guidance is. If they're a nursing home, assisted living, they'll have to follow CDC guidance. But as far as what the state is doing, we are encouraging, unless there's an outbreak, we're certainly encouraging visitation. We're encouraging people to have the opportunity to go visit their loved ones. The only thing that will remain is the testing of employees. So we will continue the testing of employees twice a week, but that is only employees who are not vaccinated. If you're an employee in a nursing home and you are vaccinated, state is not requiring any testing. But if you are not vaccinated in a nursing home and work there, you will continue to have to be tested twice a week. We're doing that because of the unique nature of the nursing home and assisted living. These are congregate care settings. These are people who many times are medically compromised. And we are still seeing new cases in nursing homes. The numbers are dramatically down. We've been able to take them down. We're providing free the testing. We're putting the vaccine in the nursing homes for new people who are arriving. So we're doing absolutely everything we can to keep these numbers down. We're still seeing 80 or so new cases a week in these nursing homes. And by and large, this is being brought in by unvaccinated staff. So that is the challenge. And so we'll continue, for the time being at least, continue to require the vaccination of the not require vaccination, misstated that. We will require the testing of those employees who are not vaccinated. If you're vaccinated, you will not be required to test. Ohio Department of Aging will be hosting a series of webinars starting tomorrow morning to ensure facilities across the state have access to all the information and resources necessary for safe and healthy operations. More information about these webinars can be found on the department's website at aging.ohio.gov.